Hi, Dr. Prince here with Limitless Physical Therapy, and we're going to talk about reducing pain in the hips with our lower body exercises. So a lot of times with hip pain, what patients tend to do is they are going to laterally shift or have pinching in the front of the hip. So if they're having pinching in the front of the hip, let's say with a deadlift, what you can do is you can take one of our 2x4s and elevate the hips, the knees, and that will clear the ankle joint. So a lot of our clients will have tight ankles from being at a desk, so that can help. You can also change their range of motion. So you can change having their ankles wide or narrow. Everybody's hip ranges of motion are going to vary based off of them. So changing where their feet position is can help. Now, let's say they are having pain with a forward lunge, or if they're really off balance, sometimes that can cause pain with having to stabilize a person that's not able to stabilize. So what you can do is widen their stance with a lunge, and that will give them an increase in base of support. Very good, very good. And then you're still getting that unilateral activation of the leg. Sometimes it's an issue with support, so you can either falter to the TRX straps, or you can have them hold on to a dowel to give them additional support as like a walking stick with a lunge. Again, too, if they're having pain with changing the range of motion, going in and out of that movement, what you can do is, Stephen, let's have you go into a lunge and hold it. You can have them hold that muscle, that exercise, and you can have them do an upper body task. You can have them do bicep curls. You can do truncal rotations, so hold it up and go side to side. So then you're still getting activation of the hips by keeping that static posture, but then having to stabilize with your trunk moving. And that will still provide them with a really difficult workout, but not having to have pain getting in and out of that movement.